Welcome to The Explainer. For anyone dealing with severe muscle spasticity, finding relief that actually lasts can feel like an impossible battle. Well, today we're looking at something pretty incredible, a medical innovation that's really changing the game for this tough-to-treat condition. Just listen to this quote from a patient. "Do you know how liberating it is to be able to shave your underarm?" I mean, that really hits home, doesn't it? It's a perfect reminder that what we're talking about today isn't just about clinical trials or data. It's about giving people back their dignity, those simple, everyday freedoms that so many of us take for granted. So what we're going to do is tell the story of this innovation. It's about how a really dedicated team is creating these new possibilities, especially for people who thought they'd hit a dead end with the usual treatments. All right, so first things first, let's really get a grip on the problem we're trying to solve here. What exactly is spasticity, and why is it such a monster to manage? So spasticity, it's not just, a tight muscle. It's way more complicated than that. It's a neurological thing that can happen after a stroke or with conditions like MS or cerebral palsy. Basically, the brain or spinal cord is damaged, and the result is this painful, involuntary clenching of the muscles. It can lead to some really debilitating deformities and just severely crushes a person's ability to live their life. Now, you might be thinking, what about treatments like Botox? And yeah, botulinum toxin can definitely help, but for a lot of people, they eventually hit this plateau. There's a limit to how much you can safely use. In fact, research shows that something like a quarter of patients could probably get better results if they could just get higher doses. But they can't. And that leaves this huge, critical gap for people who feel totally stuck. They need new options to keep their recovery going. Okay, so here's where the story gets really interesting. The first big leap forward wasn't even a new treatment. It was a much, much smarter way to figure out what was actually going on. How do you tell if a limb that's locked up is because of spasticity you can actually treat, or if it's a permanent contracture that's, fixed in place? And the answer is something called a diagnostic nerve block, or DNB. The best way to think about it is like a test drive for the nerve. A doctor injects a teeny tiny amount of lidocaine, a local anesthetic, right at a specific nerve. This temporarily knocks out that spastic muscle. And if, all of a sudden, the person's range of motion gets better, boom, that's your proof. It confirms the problem is reducible spasticity, and it's an amazing predictor that a longer-term treatment is going to work. So what makes this test drive so effective? It all comes down to incredible precision, and that's where modern ultrasound really shines. First, the clinicians use it to pinpoint the exact nerve they need to hit, making sure to steer clear of blood vessels. Then, just to be extra sure, they can confirm they're on target with a tiny little electrical pulse. Only then do they inject the anesthetic. And the result? You see right away if the motion improves. The whole thing is safer, faster, and way more accurate than it ever used to be. All right, so let's get to the main event. Once you've done that test drive and you know a nerve is a good target, what's next? How do you get an effect that lasts longer than a quick anesthetic? Well, the answer is pretty cool. Literally, it's a highly targeted big freeze. This procedure is called cryoneurolysis. It's minimally invasive. A specialized probe, guided by that same ultrasound, is placed right next to the target nerve. Now get this, the tip of the probe gets insanely cold. We're talking down to minus 88 degrees Celsius. It uses the body's own water to form a tiny, super precise ice ball right around that nerve. And that ice ball is what temporarily stops the nerve signals that are causing all that spasticity. Now, here's the absolutely crucial part. This does not cause permanent damage. The biological process is called axonotmesis. The intense cold disrupts the inside of the nerve, the axon, but, and this is the magic, it leaves the outer protective layer totally intact. You can think of that outer layer like a tunnel. It allows the nerve to slowly and naturally grow back and regenerate over the next few months. It's a completely controlled and, most importantly, reversible process. And that selectivity is a massive advantage over older techniques that use chemicals, like phenol or alcohol. See, those chemicals could be a bit of a blunt instrument. They could cause a lot of collateral damage, destroying nearby muscle and even blood vessels. But the big freeze? It's like a sniper. The cold specifically targets the nerve, leaving all the surrounding healthy tissue perfectly fine. Okay, so it sounds great in theory,
But of course, the two big questions on everyone's mind are, is it safe? And does it actually work for patients?
First up, safety. Well, according to the first major safety analysis of this, the answer is a huge yes. Check out this number. In a study involving almost 300 different nerve treatments, an incredible 96.75% of them had no lasting side effects like pain or weird sensations. The very few issues that did pop up were minor and temporary. That shows a really, really strong safety profile.
Okay, so it's safe. But does it work for those patients who've hit that plateau?
You bet it does. This pilot study looked at patients with really severe spasticity in their shoulder and elbow. After just one treatment, they saw this dramatic, sustained improvement in their range of motion. But here's the most amazing part. Those improvements were still there a full year later. For someone who felt like they were stuck, that is a total game changer.
And these aren't just numbers on a chart. The impacts on daily life is profound. Listen to this from a caregiver for a 15-year-old with cerebral palsy. They reported that after the procedure, everyday things like getting dressed, washing, or even just sitting comfortably in his wheelchair got so much easier. That is a life-altering improvement, not just for the patient, but for his whole family.
But maybe nothing captures the sheer potential of this treatment better than this one quote. It's from a patient with multiple sclerosis who had this painful clawing in her toes for decades. After the procedure, she said, and I quote, "I lifted my toes up off the floor for the first time in 20 years. Just, wow. Imagine that. A moment of recovery that had been impossible for 2 decades. And this whole thing isn't just standing still. This isn't a one-and-done discovery. The field is already moving forward. Clinicians are taking this foundation and really pushing the limits of what this tech can do. The innovation is just picking up speed. Clinicians are figuring out new positions to access muscles they could never reach before. They're combining this freeze technique with other procedures to tackle multiple problems at once. And get this, unlike with Botox, there's no maximum dose, so they can treat several different limbs in just one session. And this know-how is spreading like wildfire, with centers all over the world starting to adopt the technique. This entire journey, from a smarter diagnosis to a safer, more effective treatment, it all started with a simple goal: to help people who felt like they had nowhere else to turn. And it leaves us with this really powerful question for the future of medicine. What if we could offer a reversible, long-lasting, and super-targeted treatment to everyone who has hit a wall in their spasticity care? What if every plateau could be turned into a new starting point? The evidence we're seeing suggests that for so many people, that future is finally starting to arrive.